Hello, Nebraska, and welcome to this week's episode of the Retirement Compass, the show that helps you successfully navigate to and through retirement, brought to you by the team at Stonebridge Wealth Management. I'm your host, Kristen Oakley, and in the studio with me today is Tim Kulhanek. He is founding partner, financial advisor, and Jeremy Gove, senior financial advisor. Tim and Jeremy, it's great to be back with you. What is going on in your world this week?
Lots of stuff. My wife took our girls to the zoo.
Oh, fun.
And there's giraffes that you can feed, right? You can buy these pieces of lettuce, basically, and their long tongues will stick out. My daughter decided she got the courage to feed the giraffes this time, but as soon as that long tongue started coming, she just threw it in the giraffe's face.
Take it.
Yeah, it's entertaining.
That's awesome, I know. Well, and how about in your world, Jeremy? Anything new, exciting?
Nothing that exciting, but
it's pretty exciting.
Yeah, it's pretty exciting
Romaine
stuff.
lettuce.
Romaine lettuce, you can't go wrong there.
Right.
So.
Well, you guys have prepared another fabulous show. We're going to be talking today all about the greatest risk to your retirement. Do you know what that is? We're going to be talking today about healthcare. That is, for so many people, the greatest risk to their retirement. And so we're going to unpack that today. And the reality is it's not always the most exciting subject, if you will, but because so many folks are concerned of running out of money, healthcare is one of the direct correlations to that fear. And so it needs to be talked about, it needs to be addressed. So I want to start with the fact that healthcare in general, I know, Jeremy, you have called it a little bit of a political football. Yeah. So share with our viewers what you mean by that, and then we'll just get into it.
Well, healthcare in general is a political football just because you've got both political parties that are trying to solve this problem. In the United States, we spend double what the other industrialized countries spend on healthcare. And I think there's a lot of reasons for that, but the reason I call it a political football is just because there's so many, everybody has a solution, but they're not willing to agree or come to terms that maybe some of what your ideas are as good as mine, and maybe we can kind of mend that together. And so it can become challenging for sure. And so when we talk about healthcare, as you mentioned, it's a huge risk to people's portfolios. And so when we're doing our planning for our clients, we talk about things that we can control. Yes. So we're always talking about that. What are things that we can do? And then we also talk about things that we can't control. And so obviously healthcare is one of those things that, your genetics and stuff like that, those are things we can't control, but we can't control our diet. We can control how much we exercise, those types of things. And those are always those things that you don't really want to hear. But we spend a lot of time talking about those types of things. And as far as the health insurance and where do we go when you're retired, a lot of people, when they're thinking about retirement, they're thinking, okay, so can I actually retire? So from a financial standpoint, they may be able to retire.
Right.
But then the question is, well, how do I cover my healthcare costs?
Right. So explain that, because Medicare doesn't kick in until age 65. Right. So if you want to retire prior to age 65, that's what you're talking about, right?
Yeah, and that provides a huge challenge. And so we have a lot of people where one spouse may continue working past when they would normally retire just to provide that health insurance for the other spouse. And so maybe one qualifies for Medicare, but the other one doesn't, so they just keep working until the other one qualifies. And so that can provide some challenges, but as you mentioned, healthcare is a tremendous expense, and we need to do things to try to mitigate that. And there is definitely things we can do through our planning process.
Right. Well, I know one of the biggest misconceptions out there, people think, oh, great, once I turn 65, Medicare is going to kick in and then I'm home free. Is that really the case, though?
Yeah, I wish it were that simple. As we get older, obviously, our bodies deteriorate and we have a lot more health issues. And I think the national average is in our retirement years, we'll spend about $6,500 more in our retirement years on healthcare than we do prior to retiring.
Which is important to note, because I think a lot of people think they'll be spending less money in retirement, but that right there alone is a cost that tends to go up.
Absolutely. And so, and then there's a lot of things that, that are coming into those calculations that when we're assessing the cost of our healthcare and retirement, you have things like IRMA, and Tim mentioned that in other shows, where grab these numbers here. If you're single, if your income's above $97,000 and you're single, you're going to pay additional costs for your Medicare premium. If you're married and you're filing jointly, it's $194,000. And so that tax can actually come into play where you end up paying more for your health insurance. And one of the challenges with that is when people retire, it's interesting. People come in and they talk to us and they have these preconceived ideas of what they're going to do.
Right.
It may, maybe they have $1 million in their 401k and they're thinking, we're going to pull out $150,000 when we retire just to pay off our house, which on the surface, that sounds like a good idea because they're paying off their house. So they're not going to have that expense while they're in their retirement years and on more of a fixed income.
Right.
But the challenge with that is, I just gave you those numbers. If you're married and your income's $184,000, you're going to pay more on your health insurance premiums. And so the ironic thing about that is they actually look back 2 years. So there's a lot of planning that we need to do because you might do something today that seems like a good idea, but you're going to pay the price for that down the road.
I'm so glad you brought this up because I have heard horror stories as well. And IRMA, just to unpack that, it stands for Income Related Monthly Adjustment Amount. We talk about it on the show all the time. There's so many acronyms in this industry, right? But IRMA is one of those you want to know about because it can really come back to bite you. I heard of a couple who sold a home, right? They were buying a downsizing, and so they sold the home. Well, didn't think anything of it. And next thing you know, their Medicare premiums had just skyrocketed. And they went to their financial professional and said, well, why did this happen? And he said, well, what did you do? They're like, what do you mean? What do we do, right? They had sold the house, that bumped up their income, and then they were bit by that.
Yep.
Yeah, there's a lot of things that can impact your Medicare premiums. Anything that it's based off of what we call your modified adjusted gross income. It's not something, so for our viewers, if you're thinking, well, where's that on my tax return? I'm gonna go find what my modified or MAGI is. It's not an actual line item. You can find your adjusted gross income, and then we can help you do the calculation to find out what your modified adjusted gross income is. There's some things that we need to add back in, like non-taxable Social Security. But this is why having a guide through retirement, I think, is so critical, because what Jeremy and I can do is we can tell you if you're going to have a potential IRMA problem, if you will, or income-related monthly adjustment amount. And if you're, watch one of our previous shows where we talked about things like taxes and Roth conversions. A Roth conversion can impact and will impact this. But I see it all the time. I did a tax planning workshop not too long ago, and there was a gentleman with a very very similar story to what you just explained, Kristen. But he had cashed out his 401k. Wow. Okay, so to put my Dave Ramsey, persona on, that's a terrible idea, right? He cashed out his 401k to pay off his house and then buy more real estate.
Wow.
He ended up paying over $500 a month for his Medicare Part B for a year. 2 years later, because the 2-year look back.
Right.
That's a really expensive mistake. And so, folks, you might be thinking, oh no, what if I've made this mistake, or what if I, wasn't paying attention and ended up paying more? You can still fix your mistakes. You don't have to compound the problem. I think about, Jeremy's a great golfer. I'm terrible at golf. I think I have the record for most fairways missed.
Nice.
So, I was playing golf here. It was a few years ago with a buddy of mine, Dane. Hi, Mels. And I hit it into the woods, into the trees, and I'm thinking, okay, you know what? This is okay because I got a clear path between these 2 trees up here. As long as I miss both trees, those branches, I'm gonna be right back on the fairway, and I'm on pretty good shape looking to be on the green and hitting par.
Right.
And I'm lining the shot up, and he says, well, what's a par? I say, well, it's even, right? He says, okay, what's a bogey? Dane, I know what a bogey is. It's 1 over par.
Right.
So what's a double bogey? 2 over par? He says, wrong. Double bogey is a bad shot followed by a foolish shot, okay? So the point is, we don't need to compound our mistakes. You know what? We can say, all right, we maybe made a mistake with what we were doing with our previous tax strategy because we really didn't have one.
Right.
Let's correct it and get back in the right lane. So that way we make sure that we're not paying too much for healthcare, and those costs really add up.
Right, for sure. So if someone's watching today and they're going, gosh, I need help with all this, right? I mean, and even it's never too early to start, especially with that look back period. So what would you say to them?
Yeah, I mean, I would say that'd be a reason you'd want to give us a call. Absolutely. You don't have to go it alone. If you give us a call at 866-256-7778, we're going to hold your hand through this. We've landed this plane. You can be on autopilot. After the takeoff, in the middle of that flight, autopilot, that's fine, right? But you don't really want to be on autopilot when you're coming in for a landing and there's a breeze coming off the ocean, it's a crosswind. You want somebody who's tenured, who's experienced, who's done this before. Our team has, and we can help you with that process as well.
Wonderful. Tim, Jeremy, thank you so much. To our viewers at home, we are going to take a quick commercial break, but we encourage you call that number on the bottom of your screen to get your complimentary retirement readiness review from Tim and Jeremy and the team at Stonebridge Wealth Management. Again, this is for no cost, no charge, no obligation. They would love for you to come in. They'll look at your entire financial situation, and if healthcare is a huge concern for you, they'll be able to navigate that for you as well. That number to call is 866-256-7778. You're also welcome to take out your smartphone. Simply scan that QR code in the bottom right-hand corner of your screen. That will take you over to a landing page, ask you a few simple questions, and a member of the team will reach out to you and connect with you so you can set up your complimentary appointment that way as well. We are talking again all about healthcare, the greatest risk to your retirement. When we come back, are you concerned about long-term care? Hear what Tim and Jeremy have to say about that right after this.
Good morning, Ben.
Good morning, Ben. Hey, birthday party for Carolyn 5. Happy birthday to you.
Good morning, Ben. Happy Monday.
Daryl's birthday, be there every square. Happy birthday to you. As you can see from our quarterly report on slide number 62, we're trending in the right direction. All signs point to a very positive outlook for the next several years. If you peel back the onion
Ben, do you have anything to add?
The work never seems to end until the day it finally does. Call today to get your free written financial plan so you may live every day to the fullest and enjoy the retirement of your dreams.
Welcome back, Nebraska. You're watching the Retirement Compass, which is helping you navigate successfully to and through retirement. I'm your host, Kristen Oakley, and I'm joined by Tim Kulhanek and Jeremy Gove from Stonebridge Wealth Management. We are talking today about the greatest risk to your retirement, which are healthcare costs, and even more specifically, long-term care costs. I mean, the reality is we are living longer than we ever have before. And with that comes these new set of costs that previous generations didn't have to navigate. And I wanted to share this stat with our viewers. According to the 2021 Cost of Care Survey, which was conducted by Genworth, the annual median costs for long-term care can range anywhere from $54,000 all the way up to almost $110,000 per year. So my question for you all is, how can retirees prepare for these substantial costs?
Yeah, the first thing I think we have to recognize is that that might be a range depending on the level of care somebody needs, but we can't forget how quickly these costs are increasing. In fact, medical inflation has been at least double what traditional or more core inflation has been. In fact, I think over the last several years, medical inflation has been around 12%. And so when we're looking about long-term care for people retiring today, we're not looking necessarily at these numbers of $108,000.
Right.
We could be looking at $200,000-$300,000 a year later on in retirement.
Absolutely.
Now the question becomes, how do we cover that cost? And really, the way I see it, there's a few different ways. You can self-insure, and that's fine for folks who have substantial enough resources. If you don't need long-term care at all, which statistically speaking, obviously is the odds are you will.
Right.
Over 60% chance, but if you don't need long-term care, you might consider that the least expensive. But if you do need long-term care, it's the most expensive, okay? Then there's programs that if you run out of money, which I'm not suggesting you're gonna run out of money because of long-term care, but some people will, and then they'll qualify for Medicaid, which is a state-based program, which there's less flexibility. You know, I had a client
Oh
Go
yeah,
ahead.
I was gonna say less flexibility, and usually those facilities are not the greatest.
That's what I was just going to
You
say.
don't want to end up there.
No, and you might be removed from a facility you were in because they
Right.
don't have a Medicaid bed. And
Right.
I've seen that happen. And that's a pretty unfortunate, kind of a sad situation where you were in one of the nicer communities in town, retirement communities, and then you're having to move, you know, and maybe not a really desirable location.
Right.
And then you can put together some sort of VA benefits for veterans, but again, there's more limits on that because there's high demand. And then you can find some sort of insurance arrangement. I know Jeremy's talked on a previous show that it used to be traditional long-term care where it's kind of like your homeowner's policy, and if you have a claim, they'll cover it, but if you don't have a claim, they're not going to give you any money back.
Right.
We're more fans of a type of arrangement where if I need long-term care, great, there's something there for me. If I don't need long-term care, my beneficiaries are getting that money back. Or maybe I can even take the money back out if I change my mind. There's more flexibility
Yes.
in this space than there ever has been in history.
Well, it's interesting to note that a lot of the long-term care insurance companies are now out of business,
Yeah.
right? Because
Right.
it's just become the situation the way it is. People are living longer. It just was not a cost-effective route to go.
Yeah.
So. Yeah, and you know, it's interesting because I know you have several strategies to help people specifically cover these costs. I'm curious, unique to Nebraska, because these costs obviously depend on where you live. So do you have figures for what in general people are having to pay in Nebraska specifically?
Yeah, I mean, real quick, Jeremy, I'll just say my grandmother, she was in a long-term care facility in a small town. So we're not talking about in the metro area in Omaha or Lincoln.
Right.
And she was paying $9,000 a month.
Wow.
Okay?
And was that a private room, semi-private? Do you
It was a
remember?
private room and yeah, for a higher level of care.
Sure.
But even in a small little town,
Yeah.
you're talking about $9,000 a month. Not a lot of people have that built into their plan. Pretty much nobody has that built into their plan.
Right, and the costs are just absolutely astronomical. They need to be accounted for. So what do? We don't want to depress people, right?
Yeah.
We got to have solutions. We got to have a plan. So what do you have to say?
Well, so I think, as you mentioned, we need to have a plan. And it starts with going through our retirement compass. And healthcare is one of the 5, I'll call them ingredients of our plan that is really critical to plan for. I think statistically, 63% of Americans are going to use long-term care at some point in their life.
Right.
That doesn't mean you're going to be in a nursing home. That means, you know, maybe you fell and broke your hip or something and you're in a skilled care facility to rehab. But 63% of Americans are going to use long-term care at some point. And so traditionally, the solution has been to sell a long-term care policy. That is kind of that 20th century, you know, if we want to go back to what we talked about, 20th century solution for a 21st century problem.
Right.
And the problem with long-term care insurance is it starts out very inexpensive, but then each year or every 3 years it starts to go up, and the cost of the premiums continue to increase. And then what the insurance company will typically do is they'll say, well, we won't increase your premium if you reduce your benefits. And so when the plan was put together, it was to have this benefit when you actually need it. Well, if you start deteriorating that and breaking that down, now we don't have the coverage that we thought we had.
Right.
So now our plan is just messed up. And so we like to use, as Tim mentioned, there's a lot of hybrid products out there that we like to use that will provide a benefit even if we don't use long-term care. There's additional benefits that might go to our beneficiaries or it might go to someone else. But we want to do something where we're getting a real value for our money. We don't want to just pay for something that we're not, well, statistically speaking, there's a 37% chance we wouldn't even use it. So we want to do something where we're going to get some bang for our buck.
Right, that flexibility. I mean, because again, this is such an unknown. None of us know how long we're going to live. We don't know what our health is going to be. You may need it, you may not need it. I mean, the stats show that we need to be prepared.
Yeah.
For sure.
So I think one example of what can happen and why we've kind of shifted you know, our focus when it comes to planning for long-term care. I had a call from a client of mine, a gal that lives in Gothenburg, and she had gotten a notice from her long-term care carrier, her provider, her insurance company, not to use lingo, right? So her insurance company sent her a letter and said, hey, listen, we'll call her Sandy. Sandy, we're going to increase your premium by about 50% over the next year. And then the next year, we're going to do another 50%.
Oh my gosh.
And then the next year, I'm not making this up, we're going to do another 50%. When she first took that policy out, she's paying maybe $50 a month, 30 years ago, 20 years ago, whatever it was.
Right.
soon she'll be paying, if she kept going the way she was going, over $1,000 a month.
Oh my word.
For the same policy.
Yeah.
And she's gotten nothing out of it. So what
Right.
we're gonna do is we're gonna take a position where if we can get into some sort of strategy where we know, A, we're gonna get some money back, whether it's for long-term care or for beneficiaries, and B, we're guaranteed our premiums will never increase. You can get that. Those strategies are available, and they actually oftentimes aren't, if you think about the true cost of long-term care, aren't as expensive as some of those older traditional policies, but you have to be working with an independent fiduciary advisor who has access to a broad range and not just a kind of sliver of what's available out there. At our team at Stonebridge, we do have access to that. We'd love to share that information with you. You can call the number on the screen, 866-256-7778, or go to our website, stonebridgeiwm.com, and you can either click on attend a meeting to come to one of our live events or schedule a meeting right through the website.
Wonderful. Tim, Jeremy, thank you so much. To our viewers at home, we are going to take a quick commercial break, but we encourage you to call that number on the bottom of your screen for your own complimentary retirement readiness review. Tim and Jeremy and the team at Stonebridge Wealth would love to help navigate through all of these complexities for your healthcare needs as much as possible. So when we come back, we're going to dive into some other things you definitely need to know and be prepared for. Stay with us.
When was the last time you saw your financial professional? Are you getting the most out of the strategy that was created for you? Although you've done a great job finding someone to help plan for your future, are you 100% sure that you were given the right strategy? We can help answer these questions and more with a complimentary second opinion evaluation. We will take a look at what you have in place and then help determine if you're well positioned to get the most out of your future retirement income. In the event that it is not, we can help by making suggestions and showing you how to get on the right path. You wouldn't get just one opinion when it comes to a major health decision, so why would you treat your most important financial decision with such disregard? Call today for your no-cost, no-obligation second opinion evaluation to see if you're getting the most out of your retirement income plan.
Welcome back to the Retirement Compass. We are talking today about navigating healthcare costs in retirement, which can be the greatest risk to your retirement plan. And one of the things I appreciate about you guys is you always bring a wealth of stats, which I think really helps, set the context for these conversations. And a recent stat said that 62% of today's retirees are really fearful that they are not going to be able to cover their long-term care costs. And we know that there's so many emotions that are wrapped up into all of this anyway. So I want to just ask, how do you help folks alleviate this fear at Stonebridge Wealth?
So again, it comes back to our retirement compass. So if you have a plan in place, that naturally will alleviate fear, because we know, okay, we have a solution, here's our problem, here's our solution, here's how we're going to deal with it. And that's just naturally, when we meet with clients and they're at the end of that planning process, you can see when we first start the process, they're stressed, they're tense, there's a lot of questions that they got in their mind. And at the end of that process, you can just see the weight is gone, because they know we've addressed all of these things, and specifically healthcare, we know we do have a solution to the problem.
Right.
Nobody wants to try to deal with it at the point of, my wife just got diagnosed with Alzheimer's, I can't take care of her, I'm gonna have to put her in a home, how am I gonna pay for that, what are we gonna do? Nobody wants to deal with that problem when you're also dealing with the fact that your wife has Alzheimer's.
Yes.
And so it's really important for us to have a plan that we know here's what we're going to do. And it just makes people's lives so much easier and less stressful.
Yeah, for sure. Well, talk about some other strategies. I know we only have a few minutes left in the show, but what are some other things that you would encourage folks to be considering? And I guess a question that's coming up for me is, how early should someone start planning for these things?
Yeah, we've talked, again, in past shows, Jeremy said, look, you're not really, when you try to access some sort of solution, it's not necessarily based on what money you have. It's based off how you've taken care of your body, your health status. Jim Rohn said, take care of your body. It's the only place you have to live. But the reality is, we live in a fallen world where the older we live, our bodies break down.
They do.
And things stop working, and all of a sudden you've got high blood pressure, or you've got type 2 diabetes. It's very common in the United States. So what I'm getting at is, the sooner the better that we can start planning for these things. one of the things that a strategy we've used a lot, because folks might think, well, I've got some insurance products, maybe that'll work. A lot of the older products didn't cover these types of situations.
And Medicare doesn't, I think that's the other misconception, right? People think,
Absolutely.
oh, I'll be fine. And the reality is it doesn't cover especially long-term care.
With rare exceptions, it's not going to cover, it won't cover what we call custodial care.
Right.
If you're expected to recover, if you go to Madonna after some sort of health event and you're expected to recover, Medicare might cover that. But if you're long-term going to be in this situation, it won't. And so we got to look at what do we have, what tools do we have available to provide for this potential need. And I've always said, look, when you implement a long-term care solution, you're not buying it for yourself. You might be listed as the beneficiary of that, but you're buying it to prevent the emotional, physical, and financial consequences to your family. Because caring for a chronically ill person will make the caregiver chronically ill. I've seen it in my own family.
Yes.
And so oftentimes, folks, you might have a lot of different products out there that you've picked up off the shelf over the years from different financial professionals, maybe yourself. But I kind of compare this to going to the symphony. If you've ever been to the Orpheum or the Lied. Anyone been to the symphony, Kristen, before?
Not lately, but
No?
yes.
Jeremy?
Once or twice.
Once or twice. So here's what happens at the symphony. If you show up early and they're practicing, you've got an oboe over here, a cello over there, a violin, drums. It sounds like cats fighting, right?
Yes,
Because
the warm-up phase,
their warm-up
right?
it's screeching. Everything is playing on their own sheet of music and practicing. But then an interesting thing happens, right? Out walks this person that's dressed to the nines in a tuxedo and a bow tie, carrying a little stick, okay? And as soon as he raises that stick, the conductor goes silent, okay? What happens next is like the most beautiful thing you've ever heard. All of a sudden, everyone's on the same accord. Everyone's playing to the same sheet of music, and you get to just sit back and enjoy, right? That's really what we want retirement to be for our clients. We don't want you to try to conduct 15 different financial products that you've picked up over the years. That's our job, okay? So you can sit back and spend time with your family and just know your plan is set and in place, and we look forward to seeing you soon.
That's a beautiful analogy. Thank you so much for sharing that. I know that's what we want to provide is hope and solutions for our viewers at home. So
Absolutely.
Tim, Jeremy, thank you so much. Thank you so much for watching. Again, that number to call on the bottom of your screen, 866-256-7778. We love you, Nebraska. We'll see you next week.